hearing The Paul W. Smith Show. News Talk 760 WJR.
Well, look, as if we didn't have enough to worry about with COVID-19 becoming COVID-20, COVID-21, etc., there's also this heat wave, unprecedented heat wave with high temperatures, high humidity, air quality index problems, just a bunch of difficulties. And on the front line is Dr. Roy Elrod, who is there with emergency medicine at Detroit Receiving Hospital. And Dr. Elrod, I thank you for coming on board this morning to kind of give us a little help, a little, advice on how to deal with this excessive heat. Good morning, Doctor.
Oh, good morning, and thanks so much for having me on. It's always a pleasure to get an opportunity to share information, particularly as it relates to health and caring for oneself to the community. I think it's very important. And being in the emergency department, I think there's an opportunity to make sure we can inform patients so that they don't have to make visits there if they can do certain things.
That's exactly what we want to do. We want to try to cut down on your business, frankly. We want to try to keep people out of the emergency room. The obvious answer comes to my mind, and that is to hydrate, hydrate, hydrate.
Absolutely, and that's well stated, only because, for the body to maintain its status, which is 98.7, that's where it wants to be. Having fluids inside the body works in numerous ways to keep maintaining that temperature. So there's reasons why the body does what it does, either in extreme heat or extreme cold. And so fluid has an important role for our body, which is made up of really just a lot of cells. And those cells having hydration is very important to its ability to function. And so when you try to use just common sense about, particularly if it comes to extreme heat, the body works in a way that sweating allows it to put fluid over the body as if you go into a shower, and then that dissipate heat out of the body to keep it at a certain temperature. And everything related to extreme temperatures involve mechanisms that the body does similar to that. And so hydration clearly becomes very, very important.
Talk a little bit about this extreme heat. Dr. Roy Elrod here on the Paul W. Smith Show at WJR. Extreme heat and the effect on the very young, the very old, and even our pets.
Yeah, that's true. I mean, warm-blooded animals, the impact is the same, and it just depends on really the ability of that animal to handle the heat. And so at various ages, our body composition, actually, it kind of changes. So at a very young age, our body composition of water is a little higher. And so it's not probably amazing that children can go outside, play, and sometimes don't have the same dramatic impact as elderly, because as we get older, believe it or not, our body composition of fluid is less, so we're kind of drier. We always think of that. And so it's a little bit more challenging for older adults. They need to be cooler, they need to drink a little bit more fluid, and they're a little bit more susceptible to the extreme heat. And children, I think the biggest issue is that they can be left inside a car or in a home without enough cooling that their bodies can actually overheat. And that's the concern we usually have about children.
Oh, and just another reminder that you can't leave kids or pets, you can't leave anybody in a car when it's this kind of heat out here right now. It's just that exactly. You're putting them in an oven.
Yeah, now that's, see the analogy? That's exactly correct. So the heat can either be driven into the body from outside. So sun rays, if you're not moving around, the body doesn't heat so fast inside, but you're baking from the outside. So you get heat rash, you get sunburn. It's very logical. And then as you have activity, now you're cooking kind of from the inside out, heat exhaustion. heat stroke. So all of the things that we think about really in context make sense if you think of some analogies. But you're right. You are baking a person when you put them inside of a car where there's absolutely no air and they can't find a way to cool off.
So what are the signs of heat exhaustion, heat stroke, the differences, and when it's time to go visit you at the emergency room?
A very good question. And some of the signs, if you're thinking about it, you'll right away understand. So the most extreme, when we talk about heat stroke, which can actually be life-threatening, here you obviously have the body go to extreme length to try to keep you cool, and all of a sudden now you go from profuse sweating to almost no sweating. And we already said how important it is to do that, to cool the body. You also start to lose some of the important water that helps keep a balance of electrolytes in the body. So now the compositions of those change, and now you may have confusion. You know, you don't know where you are, and you start to have an inability to think straight. So these are the areas where you're seriously enough that you should automatically begin to think of 911, because now this is the person who is going to need some IV. They're going to need to be cooled down, and probably where they're at, you won't be able to do it immediately. And they'll have to be monitored and watched to make sure that those things come back in place. So potential heat stroke and heat exhaustion basically comes from people working outside. Yeah, again, an athlete conditioning outside can be very dangerous if you don't take a break, take time to cool off. And same thing begin to happen. The body, again, how important is hydration? You begin to dehydrate first. Those are the same symptoms that begin to happen even with heat exhaustion. And then you get leg cramps. Heat exhaustion, you've been working, the muscles start to get crampy. And so those are signs where you need to stop and consider that if things doesn't change within about 15 or 20 minutes, you aren't probably going to be able to do it without maybe some support, and you probably need to go to the emergency department.
You know, a nice cold beer always is nice, especially on a hot day playing golf or whatever you're doing. But water is the first liquid of choice, I think, for hydration.
It is indeed, and we have to be careful, really, because alcohol, to a certain degree, can dehydrate you.
Right.
It has, so basically the opposite effect, because we know when you drink, you start to, go to the bathroom, and that's really the fluid that you need to have inside of you. So sometimes I think it can be almost a little confusing and challenging, because people say, well, I was drinking fluids. Well, sugary drinks, alcohol are not the form of hydration you need. You need water, you need electrolytes, and so Gatorade and some of those fluids are usually more important.
Excellent. Dr. Roy Elrod, thanks for sharing your expertise as an emergency medicine physician at Detroit Receiving Hospital. Thank you, sir.
Thank you so much. Thank you for the opportunity.
729 at WJR.